Hi, Mr. Jones. I'm Haley.
I'm Allie, and today we're going to be doing a wound dressing change and a culture and just kind of assessing the wound to make sure everything's looking good.
First, we're going to get you into a comfortable position. And since you have an abdominal dressing, I'm just going to expose that dressing there quick.
We're now going to put on our gloves after we put our hand sanitizer on to make sure we're being clean. And we're going to start loosening the edges of the old dressing and start to remove it. Just peel.
Yep.
All right, we're now gonna peel back the dressing and expose the wound bed. And we will dispose of this in the garbage. All right, now that we're looking at it, we're gonna start unpacking the wound.
As we're looking, we're going to be assessing 4 types of drainage in this wound. If there is purulent drainage, we're going to collect a culture and send that to the lab just so we can treat with antibiotics. So we're just going to take a culture, grab that, and then we would make sure that we mark it, and this will be sent off to the lab.
Now that we've sent that off to the lab, we can kind of assess more of the outside of the wound, look at the size of it. We're going to measure length times width times depth, and for depth we will be using these, putting it at the lowest part and measuring with the ruler.
So this wound is about 3 centimeters deep.
All right, then we're just gonna make sure if there is any change in color, you wanna look for making sure it's not black or necrotic, and some slight inflammation here is pretty normal for a wound like this.